Now, that's a very interesting question. Many research studies and papers have tried to address this issue. Let's start by defining stress within subfertility. On the one hand, we have acute stress circumstances related to the treatment and the medical procedures. Blood tests, ultrasounds, hormonal stimulation through oral or injected medication, going through minor surgical procedures such as egg retrieval or embryo transfer. On the other hand, there is chronic stress involved, which comes about with failed cycles, the feeling of loss and bereavement many people experience, challenges in your relationship with your partner, your sexual life, your social life, dealing with the idea that you may not experience parenthood the way you have imagined. All the things that we were discussing before. Both of these types of stress are present in fertility challenges. We know that subfertility causes stress, but can stress cause subfertility? The research here is ambiguous, and that depends very much on how you define stress. One of my great mentors, Alice Domar, points out that until recently, in most studies, stress was interpreted as anxiety, and therefore anxiety markers were used when looking for connection between subfertility and stress. And yes, some research suggests that anxiety does influence fertility, while others have failed to prove such a relationship. However, if you define stress as a combination of feelings of depression and anxiety and isolation that many people feel cycle after cycle, year after year, when they fail to get pregnant, you get the clearer picture of how such feelings can exacerbate subfertility. Another point to consider here is the obvious connection that both the emotional experience of stress as well as the great extent the outcome of fertility are both linked to and dependent on hormones. Therefore, this correlation is meaningful. It makes sense. So you can draw your own conclusions here.